You are proposing new bipartisan legislation. Tell me about it.
This is to protect pregnant and delivering women and mothers in prisons. I led a bipartisan investigation of the mistreatment of pregnant women in prisons and jails in Georgia, and the findings were shocking. Incarcerated women who were forced to undergo C-sections against their will, incarcerated women who delivered their children unassisted inside prisons and jails, in one cases into a prison toilet. Uh, Postpartum mothers forced almost immediately into solitary confinement with no access to their newborn baby. These are serious human and civil rights abuses, and that's why I've introduced this new legislation.
Why now? Why is this an issue that hasn't been addressed before?
There's a human and civil rights crisis behind bars in Georgia and across the country. That's why I have led so many deep bipartisan investigations into abuse in prisons and jails. And that pregnant women and delivering mothers in prisons and jails face this kind of abuse and mistreatment, and therefore their infant children face this kind of abuse and mistreatment is unacceptable.
I know you know this, but it's worth stating here. Uh, the Fulton County jail system is now under a federal monitor. In 2024, a DOJ report called Conditions Inside of the Georgia Prison System, and I'm quoting here, horrific and inhumane. Who's responsible for all this?
It's a crisis across the state of Georgia, the Fulton County Jail, the Clayton County Jail, our state prison system where corruption and violence and murder and organized crime run rampant. But it's also a huge problem in the federal system. Recall that I led a long-term investigation into the U.S. penitentiary, the federal prison in Atlanta, which found that for years, corruption and human rights abuses and organized crime had been running rampant in the facility. This is a Georgia crisis and a national crisis.
But at bottom, when we're talking about Georgia specifically, when we report on this, when others report on it, sometimes there are systems that are blamed, there are entities that are blamed, but sometimes folks are reticent to say who specifically is responsible for something like this. And it's a big problem and it's a sprawling problem. But in your view, who bears responsibility for all this?
Well, when it comes to the crisis in Georgia's state prison, the responsibility lies with the state legislature and the governor. When it comes to these county jails, responsibility lies with county officials. When it comes to our federal prison system, responsibility lies with the Federal Bureau of Prisons, the Department of Justice, and the United States Congress. But this is a human rights crisis at every level of incarceration, from the county jail to the federal penitentiary. Conditions in prisons and jails in America are abusive, in my view, unconstitutional. And let's remember, we're talking about pregnant women and postpartum women and their newborn babies. A pregnant woman delivering her baby into a prison toilet, unassisted, left to fend for herself, despite screaming and pleading for help. It's unconstitutional. It's a violation of human rights. That's why I've introduced this legislation.
I want to ask one last point on this topic because it's one that I'm sure you've heard and one that we hear too. There are those who will hear what you're saying, uh, and some will hear it, and I'm paraphrasing, but they'll say, that's definitely bad, but prisons are bad places. It's hard, it's rough, it's violent. Don't do the crime if you can't do the time. To people who might have that approach, that mindset, what would you say to them?
This country was founded on a prohibition of cruel and unusual punishment. It's in our Constitution. And for a pregnant woman in prison to be forced to deliver her child, her newborn infant, unassisted into a prison toilet is a disgrace. The abuse of pregnant women anywhere, whether they're behind bars or free, is unacceptable.
How often is something like this happening? I mean, how many cases of women giving birth in Georgia's prisons and jail facilities have you uncovered?
Part of the problem is that there's very poor tracking of this, very poor tracking of the conditions of birth, the health outcomes for the infant, the frequency with which women immediately after giving birth are put into solitary confinement. And part of what this legislation will do is shed light on all of that and require that data to be made public.
I want to shift gears here quickly while we have you, because you mentioned right off the top, I said, how things going, and you said busy. There's a lot going on in our country right now, and so much of it has Georgia ties. So quickly, I want to ask you this. The new Trump administration has been in office for about 5, 6 weeks now. They've pushed to reduce the size of the federal workforce. Thousands of federal employees have lost their jobs, including about 5, 6, maybe 700 in that range here at the Atlanta-based CDC. Do you support those cuts?
No, these indiscriminate mass firings of CDC epidemiologists, of doctors and nurses and suicide prevention specialists at the VA are foolish. And I'm deeply concerned that our veterans are now not going to be able to get the health care they need or the appointments they need to schedule, that the CDC is going to be crippled from protecting the nation from tuberculosis, measles, Ebola, and the next pandemic. And I'm also deeply concerned by these drastic cuts to Medicaid that are swiftly building momentum in Congress. 5 out of 7 seniors in Georgia in nursing homes are covered by Medicaid. 40% of Georgia children are covered by Medicaid. Half of all births in Georgia are covered by Medicaid. And if Republicans in Congress pursue this partisan agenda and gut Medicaid, they will be attacking the health care of my constituents here in Georgia.
You're obviously a Democrat. You've been in elected politics for a while now. You know that in 2024, Republicans scored big wins. In many cases across the board, they now control the House, the Senate, and the White House. What's the path forward for Democrats now?
Look, I'm going to stay focused on my constituents' health, their access to health care. Again, half of births in the state of Georgia are covered by Medicaid. I'm going to stay focused on standing up for our veterans, reducing their wait times, making sure they get the best possible care at VA facilities. I remain focused every day on delivering for Georgia, protecting my constituents in Georgia, and fighting for my constituents in Georgia.
Obviously, there are a lot of thorny and challenging questions that face our country. One of them that we've seen a lot of focus on here in Georgia and around the country is the question of immigration and border security. It was a big issue during the 2024 presidential campaign, as you'll remember. A lot of voters said it was among their top concerns going into that election. The Trump administration is now in office. They've pushed for, and they say they've enacted widespread immigration enforcement efforts. We've seen some of those arrests happen here in Metro Atlanta. Do you support that approach?
Georgians and the American people want, demand, and deserve a secure border. And the Biden administration failed to secure the border. I don't believe that the American people want federal police raids on churches and hospitals and elementary schools and the mass roundup of people who are otherwise following the law but leads to the separation of families or the orphaning of children.
And that's what you're seeing right now.
Well, I'm expressing what I think my constituents deserve and demand, which is a secure border and a humane immigration policy, but doesn't rip children away from their families, but doesn't have federal police raiding elementary schools. That is, I believe, what Georgians deserve and support. Absolutely secure borders and a humane immigration policy.
Senator, big picture, and I know that obviously you are in the Senate now, but before you had a career taking deep dives into big issues in your career before you went into elected politics. There's so much going on. We know that you're up for reelection in 2026. What is your number one goal for our state over the next 2, 4, 6 years?
For my constituents to be healthy and prosperous. And that's why, again, I highlight these drastic cuts to Medicaid. as a serious threat to healthcare in Georgia. And I'm reminding my colleagues in Congress, 40% of kids in Georgia, 50% of births in Georgia, 70% of seniors in nursing homes in Georgia are covered by Medicaid. And if Medicaid is destroyed, it's going to destroy healthcare for a lot of my constituents in Georgia.